Alright, so I'm gonna just record this. Get my thing out. I can't do it, bro. Ah, my back. Bro. I wore this all through work today. Sure did. Sure did. Ooh, my back. Ow, 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 ow. Ow, my back. Oh. Now somebody looking into my car, cuz. No, my mama. Don't be looking at my car, homie. You don't know me like that. I run the streets, cuz. I run the streets, cuz. My mama said, but my mama said, they be playing in my face. Oh, you motherfuckers be playing in my face. I can't believe it, yo. I feel like what's wrong with me? Like, why does it feel like I'm gonna not be doing right? Like, what the? I'm trying to figure out, like, why can't I find out? I be wanting to go to the gym, bruh. I be wanting to go to the gym. For real. Mad crazy, wildin' out. Word of mother. Murder my mother. Nobody knows. She a bad little bra, bad little bra. Hey, watch the way she shake it, watch the way she working it. Yo, girls be wanting me low key. Can you blame them though? I'm sexy. I'm so sexy. I like me too, B. The word of mother. We got to back the book about this beach. Oh my God. Who are you? I'm little Desi, bitch. I gotta get my glasses on so I can see. Like, what the fuck? Oh, I forgot. I got a camera in the car, inside my car. I see you, bitch. We good. We up from here. My mother told me that I don't gotta listen to you. You long titty having it. If you like Kevin Hart, you know what I'm talking about. Yo, my glasses is mad crooked right now. You know what? This is pissing me off. You know my Dolce & Gabbana ones are missing? Yup. Bitches. All right. We back in the fuck up, good. Word of my... We out. Okay. Oh. I be doing the most. When you know you work the night shift and you just getting the fuck up out of the way. You think, oh my God, I'm exhausted. Why do I miss my nigga so much? I wanna know. Why do I miss my nigga so much? Is it because he got them dreads? Or is it those brown eyes? Or is it the fact that he know exactly what he doing when he get between these thighs? Or is it the fact that I can't tell him no? I'm his baby, I know. Is it the fact that he's sexy from head to toe? Or he a thug nigga? on the low, strapped up, ready to hit a nigga on the coast, riding in a nice whip and get his money flow. He don't lie, he always there when I need him the most. He's everything, but I still get kind of ghosted. Man, he be really happy in my feelings. I'm in my motions. Boy, Billy be putting it on me so good I can't ignore him. Ooh, if he call me right now, I'm gonna answer. I'm obsessed with him. He's my obsession. Man, is it the fact that I always seen him? What am I gonna say? I don't know, shit. That nigga just be on my mind. What the fuck? To all my haters that wish me to lose my range, bro, these glasses is crooked as fuck. I was sitting on them. Take them off. Oh my God. I'm gonna get contacts because this ain't fair. My eye doctor told me I had 20/20 vision. 20 vision. So why the fuck is everything so blurry? I know why. Because I got astigmatism. And he told me, he said, Ms. Thompson, all you need to do is get the LASIK surgery and you'll be good. You'll be able to see and be able to do things without glasses. So you know what I'm going to do? I'm going to contact my health insurance and I'm going to see if they can help me do that shit. Because if that's the case, bruh, then let's do it. Let's go. Let's get it in. I would love to not have to wear glasses. I would love to not have to wear glasses. My vision is actually, you know what? I think it's more of a medical situation than a preference, you know? It's more of a medical than a preference. I'll tell you that right now. Word to my mother. Word to my mother. We gonna get this shit. Hold on. Is there a resident out here sitting on there? No. How would there be a resident out here at this time in the morning? They'd be doing some crazy shit. If it was up to them, they'll be up. You know what I'm saying? They would be up. This new little tripod is my everything. I keep trying to figure out stuff, y'all. But what if God is talking to me and telling me that it's okay to be with the one that I love, the one that I crave, and I can trust him? But this is the thing. I've been asking myself this one question. Because sometimes I be so quick to be thinking, oh, this man gonna just, you know what I'm saying? But the thing is, can I trust me? Y'all okay? Everybody okay? Nobody got hurt? Bad cars out here. We can't be doing this shit. Oh my God. Oh my God. Okay. But I'm just saying, like, you know, yeah. I'm doing the best I can. That's all I can say. I'm doing the best I can. I'm human. I make mistakes. I'm human. But anyway, yeah. I'm just trusting in the Lord, you know. I'm trusting in God to, you know, help me come into this new, you know what I'm saying? Just help me. Help me, Lord. Help me, God. Help me. Truth is, I should have never let you go. I should have never let. I don't even know the song. I just know that I should have never let you go, Daddy. Ugh. Sometimes I be thinking, like, I want to be better. You know what I mean? And I don't know if y'all understand where I'm coming from with this, but I'm saying, like, I want to be at my best potential. Like right now, you know, I'm making decisions. I'm making choices. I'm making moves like a boss. You know what I mean? Like, I don't got time to be sitting around heartbroken, back broken. You know what I'm saying? Questioning my existence. I just exist. And I live in that. You know what I mean? And I ain't afraid to be like, yo, it is what it is. You know what I'm saying? Like, this is the you know, a lot of times people try to project their energies, their wants and their needs onto me. Because, you know, That's what people do. They project. And, it took a long time for me to learn that. And I also realized that I could be projecting on other people as well. You know what I'm saying? And, now that I'm aware of the name of it, of what it is, I can rebuke it. So I rebuke projection. I rebuke the thought of not being good enough. I rebuke the thought of poverty. I rebuke poverty. I rebuke the fear of poverty. I rebuke the fear of being hurt. I rebuke it. I rebuke every foul spirit that come against me in this time of my life. I ask God to just keep me on the right track, keep growing me, keep nurturing me, keep loving me, keep filling me up, and keep preparing me to be ready, because, the thing is, like, with everything that I've gone through, with everything that's been coming at me and everything, one thing I can tell you right now from the biggest lesson in all of that is, if you slow down, you're going to stay down. And whoever's trying to catch you is going to catch you. And the only way that no one can get you, who you don't want to get you, because believe me, there's people out there waiting to get you. I'm not trying to scare nobody, but I'm just being real. Like, there's people out here that want to get you. They want your energy. They want to consume what you got going for yourself. You know what I mean? And I'll tell you right now, like, I know this for a fact. For a fact. Because I went through it. You know what I'm saying? People was trying to make me think I needed them. No, honey, I don't need you. I never needed you. Don't ever get it twisted. I just chose to have you in my life. But once you keep showing me time after time after time that I don't really need to continue to think that I have to keep you, then best believe you're going to have to see me let you go. And you're going to see me let you go, and I'm going to walk away, and I'm not going to look back. Because that's not what I do. You know what I'm saying? Like, everything that I learned in this time, in these moments where I had, so many bumps in the road, so many times where I could have given up, I could have thought of myself, as someone that was never going to come from out of the pit. That's what you want to call it. But you want to know something that's crazy? I never saw myself in a pit. Elaborate on that, Lil Desi. Oh, okay. I can elaborate on it. What I mean is, I never saw myself in the pit. I never saw myself dying doing what I was doing. I never saw myself broken. I didn't see myself like any of that, how people wanted me to see myself. And because I did not see myself as in that state, I became what I saw myself, and that was victory, justice, peace, celebration, liberty, love, abundance, hard work, a chance to keep going. I came up with this song, and in my song I was like, just because they had to lose doesn't mean I have to lose too. And when I said that was because a lot of times people was telling me how they had to lose, what they lost in their life, because they went through something in their life and they couldn't handle the pressure. They didn't know how to handle it. They didn't know what to do. They didn't know what route to take. They didn't know how to stay still. But you want to know something? Just because you had to lose don't mean I have to lose too. I don't want to lose. So what do you do if you don't want to lose? You got to prep yourself. You got to push yourself. You got to break your mind. You got to break your body. Okay, yeah, so I might be bugging out sometimes when I be doing 16-hour shifts, and then I go to the gym for another hour, 15 minutes to an hour. I don't know. Maybe I am tripping if I go home and I still think, yo, I can make some content and I can get some bread off of that. You know what I mean? I can do some entertaining and I can make money off of that. You know, maybe I am tripping when I'm thinking, yo, I need to be studying for these boards, but I also need to get this money so I can handle my responsibilities at the end of the day so I can rest later. But you want to know something? That's why I'm living. That's why I'm winning. That's why I still have my Range Rover. That's why I'm not out here in these streets begging for somebody to see me, begging for someone to love me, begging to be understood, begging for money. You know what I'm saying? I believe that everything that I had to go through hurt. It was tough. Man, it was tough to see the people that I loved and I had feelings for, and I always admired, and I always wanted to be around, and I always wanted to talk to, and I just wanted to be there for them. I wanted to be a helper for them. But, you know, and all that I seen was how those type of people, unfortunately, only wanted to be around me when it was beneficial to them. But when I went through my situation where God was like, you know, Desiree, I'm about to show you something. And I was like, all right, Lord, what is it? He said, hold your breath. But I want you to know, you're going to be able to breathe under this water because you're about to go through a flood, and you're about to go into the deep, and you're about to sink. I'm going to let you sink. Ooh! God said, I'm going to let you sink because you still think these people that has been clinging onto you for your every breath, for your every word, for your every laugh, for your every tear, for your money, for your pain, for everything that you got going on. You think these people are for you. I'm going to show you. Watch what I'm about to do next. Man, when I tell you God took me under, when I tell you God took me under, I was about to lose everything. Everything I worked so hard for, bruh. And I did lose a lot. I had to let go of a lot. It first started with me letting go of my clothes, my shoes, my coats, my pants, my leggings, like, you know, clothes, you know, stuff that just lingering around the house causing clutter. You know, I had to declutter. I started decluttering, man. I just started letting things go. And then it was so to the much point. I had so much stuff that I had a storage. I kept putting stuff in storage. And every time I put stuff in storage, I was just like, yo, I'm letting it go. I can't carry it with me. I can't take this with me. I had to lighten my load, and then everything else started happening. You know, I had so much money. Because, you know, I was working during the pandemic as a traveling nurse. And I was making so much money in these contracts, you know, and I had so much money. And, you know, let me tell you something. The reason why I had so much money is because I worked. So that means I wasn't spending it. Okay? And let me tell you, I prayed and I said, God, I got all this money. I don't know what to do with it. I don't know what to do with it, God. I don't know what it's for. Like, what do I need this money for? God said, invest. All I heard was invest in yourself. Invest. What do you want? You know, because I know that I've been working ever since I was old enough to start working. Before I even started working, I wanted a work permit so I could work underage to make my own money. You know? And once I hit that age of maturity and I started working, I just started working and getting money. And I just knew how to always save my money. I always knew how to manage my money. I knew how to make my money work for me, and you know what I mean, and not get consumed by it. And so when I tell you God took me under and he let me go in the water, bro, and he let me sink. Oh, he let me sink. God let me sink. But you want to know something? I wasn't really sinking because God gave me a way to breathe underneath this water. God let me breathe while I was still, when I was drowning. Here I am, I'm drowning. I'm like, oh my goodness, I'm drowning. I'm drowning. I'm literally drowning. I'm losing my life. I can't see. I can't feel my hands. I can't feel my feet. My mind is blank. I don't know what to do, but I see God's hand in front of me and he's saying, trust me. Trust me. Trust me. So I just let myself, I just sinked. I began to sink under. I began to sink under. And in that process, God said, he said, I need you to see who is for you, because where I'm about to take you. Ooh, and this is the truth, y'all. God told me, he said, because what I'm about to do in your life, where I'm about to take you, I want you to know who is and who isn't for you. Ooh. So God let me see everything straight forward, straight up. God let me see their mask slip. God let me see their heart's desires. God let me see everything, bruh. Everything. God let me see what they wanted to do to me, because they thought they had me in a deception, because they saw a plan, but they saw that I made a slip up. And because they thought I made a slip up, they thought, we own her. We own her. We can do whatever we want now. We can do whatever we want to her. Yep. God let me see everybody straight up. The crazy thing about all of what I'm saying is it's true, you know. So anyway, maybe you guys can hear me. I'm just saying, like, with everything that I went through, you know, it really helped me see truthfully myself and to see others, you know, their true selves. And I think that was like an awesome thing, because, you know, a lot of us go through life thinking a lot of people are for us, and then you find out at the end they never was. And I'm glad that, you know, everything was revealed to me how it was revealed to me. I'm in a whole new, you know, I'm in the new, I'm in the now. And you know, I'm growing and I'm prospering and I'm just being me, and I love that. You know, I love that for me. So anyway, right now I'm up and I want to use my time wisely, and I'm reviewing for my board, so I'm going to just go ahead and take a dive into this preoperative pharmacology prospect of the chapter I'm reading right now. So I was skimming through it and everything.
So basically right now I'm at the knowledge and skills review. And it says the following skills and knowledge should be reviewed before you start this chapter. Aseptic technique and law and documentation. So I have reviewed those skills and those chapters. Okay. Learning objectives. After studying, hold on, I gotta zoom in. I'm so blind. Okay, it says, after studying this chapter, the reader will be able to list the source of drugs, explain different drug resources available, discuss the importance of drug regulation, understand how drugs are named and formulated, correctly identify and interpret the components of drug label, discuss ways to prevent drug errors, list and use the 7 rights of the medication process, recognize the elements of the prescription and how drugs are ordered drugs, apply the correct protocol for receiving drugs on the sterile field, accurately convert values within and between measurement systems. Listen, describe different drug delivery devices, describe the role of the surgical technologist in handling drugs, list drug administration routes, describe the principle of pharmacokinetics, describe the principles of pharmacodynamics, explain the difficult drug categories and give examples of drugs in each category. So basically that's like in the gist of everything. That's what I'm going to be needing to know throughout this chapter. The terminology is pretty direct about drugs. So like understanding the terminology, the definition of what that drug is or what that term means in this category that I'm learning right now, which is the pharmacology. So there's a lot of different terminologies. I need to write them all down. I'm not gonna say it right now, but they're in there. But I know. So I'm skimming, So the study of drugs is called pharmacology. The term drug is defined as a substance intended for use in the diagnosis, cure, relief, treatment, or prevention of disease, or intended to affect the structure of function of the body. Okay? Students are urged to become familiar with these classifications rather than relying on lay drug terminology and brand names of drugs. A review of the basic math is located in the index. So, I do feel kind of tired. How do I get sleepy like this? Don't know. I don't even know. I'm like exhausted. Okay. Okay. Drugs. Sources of drugs. Drugs are used in modern medicines are diverted from natural and synthetic resources. Animal and human proteins, minerals, elemental metals, plants, synthetic chemicals. Most drugs are derived from synthetic molecules. These might mimic or act like substances found in nature, but they have been modified during the manufacturing process to make them safer to use. Throughout history, healers of all cultures have used microbiological natural substances in the treatment of medical and psychological illnesses. Traditional healing plants has guided the wait, am I reading wrong? Oh God, I'm so tired. Okay. Plant has guided the development of modern Is this all on the same page? Yeah, it is. Okay. Plants has guided the development of modern pharmaceuticals today. Herbal medicines have returned to modern therapy as a component of healing. Drug information resources. Drug information resources. That's the title where I'm reading at right now. Drug information, including a drug biochemical action, the correct dosage, and other technical data is widely available in books and online. Reference books are used by clinicians to research technical information about a drug, its action, dose, and form, how the drug is metabolized, its interaction with other drugs, and other details important for the prescriber and other healthcare providers. Cool. The Physician Desk Reference, PDR, is used by many primary healthcare providers, especially providers and pharmacists. It contains detailed information about prescription and over-the-counter OTC drugs needed for safe administration. The PDR is updated yearly and entries are made by subscription. The United States of Pharmacopoeia National Formulary, whatever, is the complete reference of all drugs, dietary supplements, and devices marketed for medical use in the United States. The reference is composed of many different standards sections which provide packaging, storage, and labeling requirements for drugs. The AHFS has several publications. These include drug handbooks, references related to prescribing, consumer, drug resources, indexing, and categories of drugs and drug licensing. Online drug resources are often a good way to research drugs at all levels. Okay, that's cool to know. What else do we have here? We gotta keep reading. Okay. Regulations of drug substances and devices. Excuse me. A law appropriate to prescriptions, dispensing and administration of drugs are defined by each state's practice acts. The Joint Commission requires healthcare organizations to develop policies that are in compliance with state laws which regulate who may prescribe, dispense, and administer drugs. The following roles who may perform them are regulated by law. These are procurement and secure storage. Procurement and secure storage. Prescription, ordering, and transcription of drug orders. Administration of drugs. Federal regulations of drugs is the responsibility of the FDA. This agency maintains strict regulatory control of devices and substances used on the body. These include the following: prescription drugs, generic drugs, prescription drugs, generic drugs, non-prescription drugs sold OTC, over the counter. Okay, let's go back up here. What is this? Food supplements, cosmetics, medical devices, including implants, equipment used in the delivery of drugs, wound closure materials such as sutures. I can say the word. I'm just so tired, bro. Sutures. Biologicals, materials made from live tissues. Devices that potentially harmful levels of radiation. In the United States, drugs are approved for medical use only after rigid testing and application to the FDA. The FDA authorizes the sale and distribution of drugs and is responsible for ensuring that approved drugs meet customer safety requirements. It approves drug literature and labeling so that healthcare providers and the public are informed about the nature and use of a drug and all risks associated with it. To protect the public from harm, prescription OTC medicines must meet standards for quality, purity, identity, and strength. These standards are set by the U.S. Pharmacopoeia, USP. All substances that meet these standards bear the initials USP. After their genetic name, approved substances are published in the USPNF. The World Health Organization publishes an international formulary familiarly. The International Pharmacopoeia. Right. Tell me this off. Oh, God, that's right. Ugh, I feel like I want to throw up. Am I overworking myself? No. It's 7:49, so I still have time. Prescription and over-the-counter drugs. A prescription drug is one that is regulated by the FDA. A prescription is authorization to obtain a licensed drug. Only certain state licensed professionals, e.g., a doctor, dentist, osteopath, advanced practice nurse, or physician assistant, may provide a prescription. May provide a prescription. Prescription drugs are differentiated from the OTC drugs, which are available to the public without authorization. These drugs of substances made up of large chemical market. Because these drugs require no authorization, the public may purchase them without medical supervision. You know, Tylenol, aspirin, over the counter. Over the counter, boo. We over the counter. Oh my God. Who here is me? Anybody raise your hand if you're tired? Raise your hand if you think you're overworking yourself. Raise your hand if you can't complain. Raise your hand because you take responsibility for your own actions. Damn. I want to throw up. Herbal remedies and food supplements. I'm not reading all this shit. The FDA does not regulate herbal substances as a drug. Instead, it classifies them as food supplements. Companies within and outside the United States may market substances to the American public without the stringent testing and quality control required for these prescriptions in the OTC drugs. Many herbal drugs produce psychological changes to the body and may interfere with the action of regulated medicines. The FDA regulates dietary substances such as vitamins and minerals less stringently than it does prescription and OTC drugs. Some supplements as a folic acid and vitamin A are known to be beneficial in this treatment or prevention of specific diseases. However, the manufacturer of dietary supplements does not have to prove efficacy. I don't know that word. What the fuck is this word? Efficacy of a supplement to market it. Manufacturers do have to provide that the products meet safe manufacturing. Controlled substances are drugs that carry a high risk of abuse or addiction and are specifically designated and regulated by the state and federal law. Called a schedule. The designation called a schedule is based on the risk of the drug of abuse of dependency. Controlled drugs include both prescription and illegal substances. The regulation body for controlled substances is the Federal Drug Enforcement Administration, DEA. Controlled drug schedules are known in box blah blah blah. Pregnancy and categories. Drugs are classified by pregnancy category A, B, C, D, E, X, and X to inform healthcare workers and patients of the potential risks to the fetus. If a pregnant woman takes the drug, the categories are described as the following. What the fuck happened to my thing? A. No demonstrated risk to the fetus. B. Animal studies have not demonstrated risk, and there are no accurate and well-controlled studies in pregnant women or studies in animals to show risk to the fetus, but well-designed studies in people do not. C. Inaccurate studies have been performed in animals and people. Some studies show risk to the fetus in animals. D. There is a risk to the human fetus, but the benefits may outweigh the risk in certain situations. X drugs have been proven to pose a risk that outweighs the benefit of the drug. Most drugs are listed as category D because it is unknown, rather they pose a risk, and testing would be unethical under any circumstances. Drug what is that word? Nomenclature. Oh God. Drug nomenclature is a system of identifying drugs by name. 3 methods are used in the International Nomenclature System: generic name, trade name, and chemical formula. Generic name of a drug is designed by the United States Adapted Names, USAN, Council at the time that the drug is invented and accepted for marketing. The USAN ensures that generic drug names do not sound or look alike to prevent drug errors. The manufacturer may market its drug under its own trade name, e.g. Lipitor, but the generic name must be assigned by the USAN. Examples of generic names are acetaminophen, trade name Tylenol. That's the name of Tylenol. We can say it right. Let's pull out my phone. How to pronounce it. I need to go to bed. I'm gonna throw up. My brain is like, you bitch. How dare you? How dare you? How to pronounce? ACETAMINOPHEN. Is that an H? Oh. HEN.
Acetaminophen.
Oh my God, I'm so slow. I knew this was what the word was. I just didn't know how to say it. Acetaminophen. Acetaminophen. Trade name Tylenol. And ethanol. Trade name Tenormin. Whatever the. How to pronounce.
Atenolol.
Atenolol. Trade name Tenorim. I cannot say that. T-E. Okay. Atenolol.
Tenormin.
Tenormin. Trade name Tenormin. Generic drug is one that is manufactured and marketed without a trade name. Generics have the identical properties of their trade name counterparts. Generic drugs are substantially cheaper, sometimes up to 10 times less expensive for the customer because there are no advertising and few marketing costs associated with them. By law, drugs with the same generic name must have the same chemical combination as the identical drug with the trade name. Regardless of how many companies produce it, generic drugs are tested and regulated by the same standards in identical brand name drugs. By law, they are the same as brand drugs in dosage, form, strength, safety, performance, and intended use. In general, generic drugs are much more widely available than brand equivalents. Using generic drugs can save consumers a considerable amount of money with no loss of quality or safety. Well, we gotta keep safety and we gotta have quality. That's all I'm saying. I could. Oh, almost dropped my laptop. Bonk. Never would do that. Never would drop my laptop. I've done it before and it's been devastating. Just the thought of dropping it is so devastating. Oh shit, what the fuck am I doing? I don't even know what I'm doing. I'm just like moving around because, I'm tired. Not funny. My bed is crazy. Don't look at back there. I feel like I need to be I need to be in bed. But I'm not in bed. So alright, 30 more minutes. 29 minutes. Okay. 29 minutes to just keep eating. Trade proprietary name. When a drug is developed, make sure no titty slipping out. Okay. When a drug is developed, the company that produces the drug contains the patent for it and gives it a trade name, known also as the brand name or proprietary name, under which the drug is marketed. Trade names apply to both prescription and OTC drugs. Drug patents and their names are currently granted for 20 years. After that time, the exclusive rights to the drug formula and name expired, allowing other companies to produce the same drug with their own trade names or as a generic drug. Surgical technologists may be familiar with prescription drug trade names that are used in the healthcare setting. It is important, however, for all professionals involved in the drug process to know and use the drug's generic name. This helps prevent ambiguity and may reduce drug errors in the clinical setting. nomenclatures. Generic name. These are generic names. We're looking at drugs now. I'm looking at the drugs. They're all generic as fuck. Okay. Chemical name of a drug is derived from its molecular formula. Some examples of a drug are shown. The chemical formula is listed in the package, inserted, and generally referred to for the scientific purposes rather than during the medication process. The chemical is an active ingredient. This is the specific chemical or the compound responsible for the drug's therapeutic action. Drugs also contain inactive ingredients that have no therapeutic effect. These are added for preservation, for color, or to bind the ingredients. Drug labels. All pharmaceutical products and plants are commercially labeled both inside and outside the package. The FDA regulates labeling to protect the public from harm resulting from misinformation or lack of information regarding the drug's use. A drug insert is a leaflet that accompanies prescription in some non-prescription drug packages. The insert is a detailed description of a drug's composition, intended use, action, advises reactions, warnings, and dosage. The package or container label is printed in ink and stamped on the container or carton. This information has specific importance to the health care providers who will dispense or administer the drug. Critical information on the container label includes the following: name of the drug, including proprietary genetic name, dose form, for example, solution, capsule, or dry powder, or reconstitution, amount contained in the package, for example, 1 gram or 2 milligrams per milliliter. Oh my God, I'm so freaking tired, bro. When is this over? Indications: the labeled purpose of the drug that it is used for. Dosage: the therapeutic amount to administer. The route of administration: how the drug is to be used, how the drug is to be given, e.g. intravenous or intramuscular injection. Barcode: this is a computer label that can be scanned and traced to ensure that the drug is not counterfeit and that the actual drug is the same as the label states it is. The label includes the product code, expiration date, manufacturing number, and quantity. Lot number: when each drug batch is mixed in the drug laboratory, it is assigned a lot number in the event that a batch must be recalled from use for safety purposes. Expiration date: the date beyond which the drug must not be used. The date is stamped onto the container. In addition to that, in the barcode, drugs must not be used beyond the specified expiration date. Other time, many drugs lose their efficiency or may become toxic. The expiration date indicates when the drug must be withdrawn from the market and destroyed. Illustrates 2 different drug labels as seen on the outside of the drug package. Drug formats. Drugs and other medical substances are manufactured so that they are compatible with how the drug is administered and how it reaches the target issue. The format is not the same as the route of administration. This is important point to remember. The format is also called the dosage form or the therapeutic presentation, e.g. tablet, liquid, or cream. For example, drugs that are intended to reach the central nervous system quickly are formulated as liquid intravenous injections or tablet placed under the tongue, where it is rapidly absorbed through the mucous membrane. Tablets meant for oral administration must be resistant to the breakdown until they reach the gastrointestinal GI system, where they will be absorbed through the stomach lining. Skin patches or films impregnated with medication keep the drugs in contact with the skin, which slowly absorbs the drug at measured intervals. The surgical technologist encounters many different drug forms and is responsible for correctly preparing them for administration on the sterile field. Discussed later in the chapter, the following is representative list of FDA formulations and examples of their use in surgery. The list appears in alphabetical order, shows the complete list. Cement. When used in orthopedic surgery, cement is most commonly available as powder that must be mixed with a chemical liquid dilute on the sterile field. This is done with a closed mixing device to prevent exposure to hazardous vapor, which is a byproduct of the mixed components. Film. A film is a very thin sheet of transparent or semi-transparent solid material. It is mainly used where there is a need to seal tissue links, such as in the lungs, dura mater, and vascular structures. Thin bioabsorbable film may be cut to size as a patch and left in place over tissue, which absorbs the material over time. An additional use for biofilms under research is a film barrier that prevents the inflammation and adhesions, scarring between the abdominal wall and the internal organs. Graft. A graft is a natural or synthetic substance used to replace tissue, fill in defects, or bridge a defect in tissues. Synthetic graft materials are commonly used for tissue repair. Mesh graft to repair hernia defects, and in manufacturing of blood vessels replacements. Bioactive tissue grafting materials are actually incorporated in the tissue during the healing process, providing a strong permanent bond. Implant. Synthetic and biological implants are used in many different specialties. Examples are joint replacement components and in reconstructive surgery to provide replacements where bone or tissue loss have occurred. Electronic implants are important in cardiac medicine and neurosurgery for the restoration of hearing. Tissue implants are available in many different forms. Tissue may be autologous, from the patient, or a transplant from another individual. For a full discussion on the tissue implants, refer to chapter 18. Irrigants. Fluids are commonly used to irrigate the surgical wound. Surgical saline for irrigation is used to flush tissues and prevent them from drying during surgery and to remove tissue debris. Packing. This is gauze or other soft material, usually impregnated with a antibacterial drug. The material is folded and compressed into a hollow cavity to control post-operative bleeding, such as nasal surgery, or the pack in an incision that must remain temporarily open during healing. Okay, well, that's some bullshit. Oh, my back. Oh, my back hurts so bad. I need rest. Ugh. I'm gonna throw up. Oh, excuse me. I told you I'm feeling sick as fuck. Ooh. Almost had a nip slip because of my freaking thing here. Nobody judge me because of my bed. I work a lot. But I need to go to sleep. I'm going to go to sleep here in a minute. Powder. Powder formulas are used in their dry state or are reconstituted, reformulated into a liquid during or adding a diluent. Some antibiotics are marketed by dry and must be reconstituted with sterile water or saline solution for injection. Solution. This is a water-based liquid to which one or more substances have been added. Solution for slush. This is a solution for the preparation of ice saline, which is used to irrigate tissue and induce regional hypothermia. This preparation is used in selected cardiac and kidney procedures. Sponge. This information is a porous matrix of soft absorbable and non-absorbable material. Medication may be injected into the sponge by the manufacturer. In surgery, absorbable gelatin sponges are used plain or may be soaked in thrombin and used as a surface coagulant to stop capillary bleeding. Spray. Drugs are formulated as spray to facilitate covering a tissue surface quickly and efficiently. Examples are antithetic anesthetic spray used on throat tissue before the insertion of an anal. Oh, okay. Spray used on don't know where I'm at. Used on throat tissue before the irrigation of endoscopes and spray on tissue sealants used to control bleeding capillary surfaces such as on the liver, spleen. Tincture. Tincture is any solution that is formulated with alcohol. Examples include the skin prep solution used on the operative site before surgery, and alcohol antiseptic is used in hand asepsis. How drugs work. When a drug enters the body by a route, both the body and the drug undergoes changes. That is, the drug is broken down. A change in the drug and the drug has psychological effects on the patient. A change in the body. Oh my God, how do I say this word? Pharmacokinetics. Pharmacokinetics is the study of the movement of drugs through the body and the changes that occur in the drug. Once inside the body, the drug moves through different chemical and physical pathways. As it moves, it undergoes breakdown and attachment to different cells and molecules in the body along in this kinetic path. Finally, it reaches the target tissue, is metabolized, and at the end of the process is excreted out of the body in its transformed state. In general, there are 4 main processes or events that occur in the pharmacokinetic pathway. These are as follow: absorption, distribution, biotransformation, metabolism, excretion, elimination. Absorption is a process by which the drug enters the body tissue after administration. The rate of the absorption and the amount of the drug that actually reaches the target tissue depend on many factors such as the chemical structure of the drug, the method of the administration, and the condition of the patient. Absorption involves chemical and physical breakdown of the drug. For example, oral drugs must dissolve before passing through the wall of the small intestine and liver. The substance then enters the bloodstream, where it is carried to the target tissue. Drugs that are injected directly into the blood vessel do not require absorption and thus reach the target tissue almost immediately, whereas one injected into the muscle or connective tissue usually takes 15 to 30 minutes to take effect. Many drugs contain components or actives and enhance, increase the rate of amount, or delay absorption. Distribution takes place after the drug enters the bloodstream. In this phase, the drug is distributed to the body tissue where it exerts its pharmacological effects. Not all the drug administered reaches the targeted tissue. The amount of the drug available and the rate of the availability are called the bioavailability. For example, some drugs may become tightly bound to blood proteins and are released to the target tissue very slowly. Fast soluble drugs may move rapidly across cell membranes and take effect quickly, but tend to accumulate in fatty tissues, which prolongs their effect. Water-soluble substances are much slower to act because they stay in the bloodstream longer than those that are fat-soluble. In all cases, only the free-bound drug is available to tissues for pharmacological effects. Alright, I'm done. I can't do it no more. I'm about to throw up. And I feel sick because I've been sitting here. Because I got off of work, did a 16-hour shift. Now I'm home studying for my boards. So I'm just like, it's time for bed. So if you like this video and you handled it to this far, you're a real one. You were really rocking with Little Desi, and I appreciate you 100%. But I got to go because it's bedtime, and let's be honest, I got things to do in the morning.